Thank you. So, what hopefully we'll be covering today, so we'll be discussing what actually CKD is, or chronic kidney disease, by definition, and how we pick up on it, and why actually it's so relevant and important, and why it's probably taken a back seat compared to things like diabetes and cardiovascular risk, and how we diagnose it, how we classify the various grades, and why each grade is so important, why chronic kidney stage 3 is and further deterioration from there to 4. Why is there a concern there, and how much the risk increases? The NICE guidelines, this is quite important. A lot of the time, I tend to try to go ahead of the times and manage patients' expectation and conditions based on my knowledge and research, probably from America. But actually, the NICE guidelines are very much in tune now, and we're following these guidelines perfectly well alongside our management. And then, yeah, how to manage this condition. Previously, a simple approach, just increase fluid intake, and then we'll see how things go. But now a lot more that we can do to help, and we'll be running through that. And then we'll have a case that we can go through, as it's always helpful. We've done some work in our practice where we actually created EMIS templates. So I've got a few print screens on that. And of course, afterwards, if you guys are quite proactive and keen to look into this area, and if you want the template that we created, by all means, please you can take it from us. One of our UCL students who worked alongside us, we created it, and it's just very helpful. It kind of tells you the steps at what you need to do. And remember, with all of this, like with all parts of medicine, the lifestyle aspect, the exercise, what kind of things to eat, these are all important, and this is included. Thanks, Abraham. Next slide. Good. So, what are the kidneys? So, I'm hoping most of us know what the kidneys are and where they are. The most important thing about what we need to understand is the importance of how it actually filtrates the waste products that removes from our body. But as it does so, it has an impact on blood pressure. And this is where a lot of our management now is focused towards. Some of the medications we're using now to help with chronic kidney disease about relieving pressure, and particularly relieving pressure in the glomeruli. It's also important, as you may remember, for keeping up with healthy bones, and keeping that balance through mineral and how it moves minerals across the boundaries. It also helps in making red blood cells, hence why this idea of chronic anemia, and how we develop chronic anemia from chronic diseases, heart failures and diabetes after a period of time, but also for kidney disease, you'll notice that iron levels dropping down. It's considered one of the hardest working organs in the body because it uses about 25% of the blood for every heartbeat. And interestingly, your blood goes through your kidneys about 40 times a day. And this is why our big concern and worry, and why this has become such a hot topic, is over the next few years, by what they're estimating by 2030, we sadly won't have enough space for our dialysis patients, which is obviously terribly sad. At the moment, we're just about managing, and you can imagine the huge cost burden it has on the NHS. So our drive now is, if we can pick some of these patients up early at the early stages, stages 1, 2 to 3, and intervene appropriately, hopefully we can delay. So almost pushing that can down further, to the point, respectfully, as they get older and probably pass away from other conditions, that will be the priority. Our concern now is those huge amounts of dialysis patients that are coming quicker and quicker, and then obviously renal failure to the point of transplant, which costs huge amounts. All of these factors are concerning us. So this is why there's this big drive now. And I think in many cases where we feel we can't do huge amounts, we sometimes have to accept with medicine. The medicine's not there, the speed of science is not there. But certainly in chronic kidney disease, some of the stuff we have, and one of the slides I've got today just shows some of the data in one of the medications or family of medications, the SGLT2 inhibitors, which many of you may know that we use for diabetes, and how magnificent in terms of the effect it has in chronic kidney disease, alongside what we've traditionally used. These are things like our ACE inhibitors or AR2Bs, but we'll discuss all of that in detail. Thank you, Abraham.